Hi, Dr. Mark Reeder again with another COVID update. Seems like COVID starts our conversation regardless of what it is anymore. It's hard to believe that something so small that it can't even be seen can change our lives in the world in such an impactful way. But that's where we are right now. Things haven't changed a whole lot since our last thing other than the mask recommendations. We've gone from don't recommend wearing masks to recommend wearing masks almost any time you're out of the house. I know it's gotten to the point now at least recommendations for healthcare workers in the hospitals is that you don't even touch your mask while you're wearing it at all times in the hospital. And I thought, wow, that's going to be kind of hard to eat. But I did see that they made an exception for eating. So fortunately, we can take the mask off and to eat. Otherwise, we'd be increasing the straw epidemic in the world. Masks are an important fact of life right now, and as I mentioned the last time, you can try making your own. I know I showed you how I did mine last weekend. Fortunately, there's more talented and creative people. I know one of my patients and his wife were working on making these, and they brought by some from my office staff and myself. You would have thought it was Christmas time with the staff and getting these masks. So again, thank you for those that are out there doing this service for us. Masks can really brighten somebody's day. I know I've given a few out that I've had. One was to a Korean War veteran that was about 90 years old. His was wearing out. He wasn't sure how he was going to be able to get out without a mask. I had one that I brought in from home, a spare one, and I gave that to him. You would have thought that I'd just given him $100. I had the same reaction with a restaurant cashier that still hadn't been able to get a mask. So something little like a 30-cent mask can provide a lot of happiness to people. This brings me to the focus of what I wanted to talk about today, is just mainly our mental health rather than our physical health. We're getting a lot of information on the physical health. We've talked about all the do's and don'ts in the last one, and so now I'm just trying to focus on the mental aspect of this. Obviously, it's hard not to be depressed with the settings that we're in, but God's still there and still cares for us and has a way through this. His instructions are clear on how to deal with this, and that is to help others. Like we talked about, not just focus on our own needs, which is important to go out and enjoy yourself, enjoy some of the outdoors that's out there right now with all the flowers. Or I went skiing yesterday afternoon in a private area that we call backcountry skiing, where you hike up the mountains and then ski down, and was having a lot of fun doing that. When I was coming down on my third run, I was staying in my tracks so I could go faster. And then I decided, well, I'm just going to cut out in some fresh snow, which was kind of wet and packed, and I didn't raise my ski tips up as much as I should have. The next thing I knew, I'd grown wings, and I thought maybe I'd gone to heaven because everything got quiet and was white around me. Then I realized I just landed head first in the snow, and I was not in heaven, good or bad. But anyway, there's still things out there that can be enjoyed if we're respectful of keeping our social distancing. And again, helping others, it can be as simple as giving someone a mask if we have a spare one or if we've been making them. It can be stopping by and visiting with them from outside, keeping the distance, especially some of the elderly shut-ins. And so just work on keeping your spirits up. We are going to get through this, and God has a plan through all this.